Where is the origin of coronavirus or COVID-19? Unless you are not tracking the COVID-19 news and being an ignorant. Otherwise, numerous of publications from Europe and US researchers acknowledged, directly or imply, SARS-CoV-2 or COVID-19 was circulated in both Europe and US in fall 2019 or even earlier before Wuhan, China discovered the first case of COVID-19 on December 31, 2019. The most updated findings of SARS-CoV-2 or COVID-19 from Western countries researchers. COVID-19 started in Italy, in September 2019, not in China in December. Published on November 18, 2020 by Eric Zeus. The COVID-19, or coronavirus didn't start in Wuhan, China in December 2019, as has been widely reported till now. This new or novel virus was first infecting people in Italy, by no later than September 2019, according to researchers at the Italian Association for Cancer Research, and published on November 11, as current research, by the National Tumors Institute of the Italian Ministry of Health. This study is titled Unexpected Detection of SARS-CoV-2 Antibodies in the Pre-Pandemic Period in Italy. It reports that, the first surge of positive cases was identified in September-October 2019. Evaluation of anti-SARS-CoV-2 functional NAbs identified positive samples in CPE-based microneutralization tests already collected in October 2019. Given the temporal delay between infection and antibody synthesis, these results indicate that the virus circulated in Italy well before the detection of the declared index patient in February 2020. In addition, most of the first antibody-positive individuals lived in regions where the pandemic started. In other words, thought the first officially noticed COVID-19 infected Italians were in February 2020, there had been COVID-19 infected people in Italy starting by no later than September 2019. Gabriella Sozzi, an INT biologist, told CGTN Europe that while Italy's first coronavirus patient was officially detected on February 21 in the northern region of Lombardy, blood samples taken in September 2019 showed the presence of the antibodies against the SARS-CoV-2 virus. The Italian research shows that 11.6% of nearly 1,000 healthy volunteers taking part in the lung cancer screening trial had developed coronavirus antibodies before the disease was officially detected in Italy. In another test conducted by the University of Siena, 4 of the cases positive for coronavirus antibodies dated back to the first week of October, indicating the individuals were infected in September. Italian researchers announced in March there had been a higher than usual number of cases of severe pneumonia and flu reported in Lombardy at the end of 2019, another sign the coronavirus may have been circulating earlier than previously thought. Another Italian study also reported the presence of the novel coronavirus in wastewater from Milan and Turin collected in December in 2019. This is further evidence that the virus was probably circulating in the autumn. Italy was the first Western country to record significant numbers of COVID-19 cases and has suffered 45,733 official fatalities since February, the second highest toll in Europe after the UK. With Europe already deep into its second wave, the biologist stresses that INT's, National Sensor Institute, findings could help reshape the way we understand COVID-19, particularly if there are more surges. Spain and France also found clues that the virus was circulating in 2019. In May, doctors at a Paris hospital discovered that patients they'd treated for pneumonia on December 27, 2019, had been sick with COVID-19. France didn't record its first official case until January 24, however. In Spain, meanwhile, researchers from the University of Barcelona found evidence of the coronavirus in city sewage samples collected in mid-January 2020, 6 weeks before the country's first official case. Surprisingly, a sewage sample collected on March 12, 2019 also tested positive for traces of the coronavirus. In U.S., according to the Wall Street Journal published on December 1, 2020 by Betsy McKay, scientists at the U.S. Centers for Disease Control and Prevention found evidence of infection in 106 of 7,389 blood donations collected by the American Red Cross from residents in 9 states. California, Connecticut, Iowa, Massachusetts, Michigan, Oregon, Rhode Island, Washington, and Wisconsin, across the U.S., according to the study published online in the journal Clinical Infectious Diseases. The scientists based their study on blood samples that the American Red Cross collected between December 13, 2019 and January 17, 2020 and later sent to the CDC for testing to see if any had antibodies to the new coronavirus, which is named SARS-CoV-2. SARS-CoV-2 infections may have been present in the U.S. in December 2019, earlier than previously recognized, the authors wrote. A person's immune system develops antibodies when exposed to a pathogen like a virus to fight it off. Their presence suggests exposure to a virus. In analyzing the blood samples, the CDC scientists found antibodies in 39 samples from California, Oregon, and Washington state collected between December 13, 2019 and December 16, 2019. The findings suggest there were isolated cases of coronavirus infection on the U.S. West Coast in mid-December, the scientists wrote. The results add to growing evidence suggesting COVID-19 was present outside of China earlier than previously known. Not only did COVID-19 likely appear in the U.S. earlier than previously known, but researchers have found evidence that the virus is far more widespread in the U.S. than testing indicates. Studies show that at least 40 to 50% of people who test positive for COVID-19 have no symptoms. Medical experts say asymptomatic spread clearly is contributing to fall spikes of COVID-19. By Katie Kerwin-McCrimmon, UC Health. Asymptomatic spread has been one of the most mysterious and haunting aspects of SARS-CoV-2, the virus that causes COVID-19. Do people without any symptoms of COVID-19 help spread the virus? The alarming answer is yes. Evidence continues to mount that a large percentage of people who test positive for COVID-19 don't have any obvious symptoms. Asymptomatic spread definitely plays a role in community spread, said Dr. David Beckham, an infectious disease specialist who studies viruses in a lab he runs at the University of Colorado School of Medicine. Let's define the definition of antibodies. From Mayo Clinic, antibodies are proteins produced by your immune system in response to an infection. Your immune system, which involves a complex network of cells, organs, and tissues, identifies foreign substances in your body and helps fight infections and diseases. After infection with the COVID-19 virus, it can take 2 to 3 weeks to develop enough antibodies to be detected in an antibody test, so it's important that you're not tested too soon. Based on the Mayo Clinic definition of antibodies, our body requires at least 2 to 3 weeks to develop enough antibodies to be detected in an antibody test. Therefore, the 39 blood samples collected from California, Oregon, and Washington state between December 13, 2019 and December 16, 2019 of SARS-CoV-2 antibodies presence is an evidence of SARS-CoV-2 infections which infected these blood donors at least on November 3, 2019. 21 days prior from December 13, 2019 blood samples collected date. Assuming all these 39 blood donors were infected the COVID-19 on the same day in 3 different states, California, Oregon, and Washington. The odds of all 39 blood donors were infected the COVID-19 on the same day, November 3, 2019, is very minimum chances, especially 39 blood donors are in 3 different states. Possibly, among of the 39 blood donors a dozen or more blood donors were infected COVID-19 in October or September 2019. Apparently, the COVID-19 have widely spread in US since fall 2019. I can't imagine how many people have already been infected by COVID-19 in the US before December 27, 2019. December 27, 2019 equals 21 days prior from January 17, 2020, the last batch of blood samples collected date. Let's do the math. If 106 people were infected out of 7,389 blood donors, then the infection percentage rate is calculated as 106 people divided by 7,389 blood donors equals 1.44% of the total pool of blood donors. According to the United States Census Bureau in July, 2019 estimate total populations of the 9 different states is approximately 79,026,366 people. Thus, estimate total populations of 79,026,366 people multiply 1.44% equals 1,137,979 people were infected during that period. Even though the calculation of number of people infected during that period in the US may not be 100% correct, however, these numbers are certainly good references. Especially, there are no prevention and protection measures were applied during that time. According of studies show that at least 40 to 50% of people who test positive for COVID-19 have no symptoms. Medical experts say asymptomatic spread clearly is contributing to fall spikes of COVID-19. I can't imagine how many people may already been infected in the US as an asymptomatic COVID-19 carrier. Further evidences, COVID-19 is not imported from any country. SARS-CoV-2 or COVID-19 was first discovered in Wuhan, China with notification to the World Health Organization on December 31, 2019. As more evidence continues to mount that a large percentage of people who test positive for COVID-19 don't have any obvious symptoms, asymptomatic spread clearly is contributing to fall spikes of COVID-19. Surprisingly, in US both Greenspring and Heatherwood retirement community of mysterious deadly respiratory virus outbreaks in the midsummer of 2019, from July 11, 2019 to July 18, 2019. In less than 2 weeks, both Greenspring and Heatherwood retirement community of Fairfax County, Virginia mysterious virus outbreaks infected 107 people, 3 dead, 23 hospitalized, dozens, an additional 19 employees, sick as respiratory illness in the midsummer of 2019, outside of the flu season. The most scariest part of the illnesses are that all infected 107 people had the same symptoms ranging of coughs, short of breath to pneumonia, related respiratory illnesses same as coronavirus, COVID-19, symptoms. Both Fairfax County Health Department and Centers for Disease Control and Prevention, CDC, have failed to link the cause of the deadly respiratory virus illness of both retirement community. The cause of the illnesses particular of both Greenspring and Heatherwood retirement community of deadly respiratory virus outbreaks in the midsummer of 2019 still a mystery. According of the Washington Post reported on August 2, 2019 by Frederick Kunkel, Virginia reports higher than usual number of respiratory illnesses. More surprisingly, Fairfax County, Virginia mysterious virus outbreaks in midsummer of 2019 is not the first time virus outbreak. Per Jonathan Fox statement, Virginia's statewide reporting system has counted 19 outbreaks in 2017 and 15 outbreaks in 2018 of which occurred outside of the flu season. Jonathan Fox, Epidemiology Program Manager at the Virginia Department. The fatality records of both years of virus outbreaks for 2017 and 2018 is unspecified. The repetition of total of 36 virus outbreaks occurred outside of the flu season in 2017, 2018, and 2019 is extremely rare, unusual, uncommon, unacceptable, and jeopardize our public health. Based of Jonathan Fox statement of Virginia's statewide reporting system outbreaks reports, America is deeply in trouble. It is not normal of any viral infection outbreak outside of the flu season, especially over a dozen of outbreaks prior year and 15 in the previous year per his statement.
Opinion. Why US have 36 mysterious virus outbreaks outside of the flu season during the pre-pandemic period. Why the Fairfax County, Virginia mysterious deadly virus outbreaks will remain in America history as an unsolved mysterious virus. Why 6 months later of the Fairfax County, Virginia, U.S., mysterious respiratory virus outbreaks in the midsummer of 2019, then Wuhan, China discovered the first case of the coronavirus in December 31, 2019. Why CDC was delayed 1 year later to publish the result of CDC scientists' study of blood samples of SARS-CoV-2 antibodies result from American Red Cross blood donors on December 1, 2020, 1 year later from the blood samples collected date December 13, 2019. CDC scientists said they ruled out the possibility that the antibodies they found had developed to fight off other coronaviruses, which cause the common cold. They did that by looking for antibodies specific to the new coronavirus in 90 of the samples. Further evidence that the mysterious virus outbreaks in Fairfax County, Virginia infected 107 people, 3 dead, 23 hospitalized, dozens, an additional 19 employees, sick as respiratory illness in the midsummer of 2019, outside of the flu season, further proof it is not other coronaviruses, which cause the common cold. There is no evidence that Fairfax County, Virginia mysterious respiratory virus outbreaks is not linked to the coronavirus, COVID-19. Overall, US, Europe, and World Health Organization were totally ignored the facts and playing dumb of the origin of COVID-19 and blaming China for the virus. China was the first country discovered COVID-19 or SARS-CoV-2 but not necessarily the first infected country. In fact, the first known case of COVID-19 was not in Wuhan, China, December 31, 2019 per researchers' reports from US, Italy, France, and Spain. Numerous of researchers' reports revealed, directly or imply, that US, Italy, France, and Spain are among of the first infected countries of COVID-19 or SARS-CoV-2. US, first incident, Fairfax County, Virginia mysterious respiratory virus outbreaks. First reported illness of the first patient is on June 30, 2019 in Springfield, Fairfax, Virginia. 7 months before China first known case of COVID-19. Second incident, American Red Cross blood donors, SARS-CoV-2 antibodies result. October or November 3, 2019 21 days prior of December 13, 2019 first batch of American Red Cross blood donors. 3 months before China first known case of COVID-19. Third incident, 36 mysterious virus outbreaks. Virginia's statewide reporting system has counted 19 outbreaks in 2017, 15 outbreaks in 2018, and 2 outbreaks in 2019 outside of the flu season per statement of Jonathan Falk, Epidemiology Program Manager at the Virginia Department. 36 months before China first known case of COVID-19. Italy, first incident, first infecting people in Italy, by no later than September 2019, according to researchers at the Italian Association for Cancer Research, and published on November 11, as current research, by the National Tumors Institute of the Italian Ministry of Health. 6 months before China first known case of COVID-19. France, first incident, in May. Doctors at a Paris hospital discovered that patients they'd treated for pneumonia on December 27, 2019, had been sick with COVID-19. 8 months before China first known case of COVID-19. Spain, first incident researchers from University of Barcelona found evidence of the coronavirus in city sewage samples collected in mid-January 2020, 6 weeks before the country's first official case. 15 days after China first known case of COVID-19. Second incident, a sewage sample collected on March 12, 2019, also tested positive for traces of the coronavirus. 10 months before China first known case of COVID-19. Obviously, all these countries, US, Italy, France, and Spain, were delayed to report or record their first known case of COVID-19. Thus, all these countries, US, Italy, France, and Spain, were reported their first official case of COVID-19 was incorrect date. A US reported first official case of COVID-19 is January 19, 2020. Incorrect report date. B. Italy reported first official case of COVID-19 is February 21, 2020. Incorrect report date. C. France reported first official case of COVID-19 is January 24, 2020. Incorrect report date. D. Spain reported first official case of COVID-19 is February 25, 2020. Incorrect report date. Any country delayed to report or record its first official case of COVID-19 does not necessarily mean that country is free of COVID-19 or SARS-CoV-2. The results evidence suggesting COVID-19 was present outside of China at least 6 months before China first known case of COVID-19. Surprisingly, US, Italy, and France also have patients treated for pneumonia, had been sick with COVID-19 of at least 6 months before China first known case of COVID-19, December 31, 2019. Clearly, Blaming Asians for the COVID-19 virus is ridiculous, inhumane, and not justified. All sources of the validity of information are from genuine reports during the incidents, not from satellites' images nor personals' opinions.